it's like, yeah, what's the what's the fix? It's like, this is different than, like, yeah, like a universal healthcare, like a Canada situation,
which I'm not against,
right?
I took some notes on that last night as I was thinking about it. I mean, yeah, I mean, I have mixed feelings, right? Pros and cons. The pros is everybody gets care.
Right.
Is it a right? No. One thing personally, one of the reasons I'm about it, long term it's going to be cheaper, right? When I was in school 20 years ago, it cost about $1 million a year to keep somebody with dialysis alive.
Right.
Keep somebody on dialysis alive for a year, right? Now, if you took that person when they were 20, got them good access to health care, primary care, endocrine care, maybe they were type 1 diabetic who didn't have access to insulin.
Right, you're paying less than that person over time.
Right, you're basically keeping them healthy. They're costing less every year. They're not as sick. Number one, they're not as miserable. Number two, they're functional. They can go to work. They could have their own health insurance. But if they didn't have it at a younger age because they couldn't afford it,
right,
they're screwed. Or, you look at colorectal cancer screening, right? Somebody goes for colonoscopy. They have a precancerous polyp. Boom, it's removed. Great. Come back in 3 years. Somebody doesn't go for that, that colon cancer screening. They wind up with stage 3, stage 4 disease.
And that's the first time they're getting seen.
It's metastatic. Now you're talking, instead of a colonoscopy screening, you're talking about, surgery, chemo, radiation.
Right.
They're out of work. They're no longer able, to provide for the family.
So those are big pluses for like a universal care. What are downsides that you would see from you being in the business?
Well, number one, can we
afford?
How do we produce that much health care
Right.
for the people who need it?
Right.
I also don't think it's fair for people who work and pay into a system to get same care for people that haven't
Right.
paid in, right? So
Right.
I'm not politically savvy.
Mm-hmm.
I would think some type of like tiered system would be the way to do it.
We talked about a couple podcasts ago where a lot of health concepts get politicized, right? Like with RFK in there now, people hate him, people love him. But these concepts get politicized, whether you're in this camp or in that camp. And I'm like, can we just remove ourselves and look at things objectively from a healthcare, from a keeping people healthy, from a scientific standpoint?